It was clear that these older people were not being treated as kind of human beings with decency, with dignity, treated with respect. Instead, many were being treated simply as a burden for whom there weren't enough gloves, there weren't enough incontinence pads, treated like sacks of meat, effectively throwing on the chair as that one man was done. What was clear as well, though, is that this was not unprecedented or not really unexpected. Cost-cutting, staff shortages, elder abuse, ripping off vulnerable people, all of that is inevitable when you hand over healthcare to faceless multinationals motivated only by profit. SIP2 alone, the INMO, have all pointed to privatisation as being at the root of this scandal, which means the root is neoliberal government policy carried out by successive Fianna Fáil and Fine Gael governments to outsource our care of older people to multinational corporations. In the 1980s, 3/4 of nursing homes were publicly owned and operated. Now it's less than a fifth. Private, for-profit operators control 74% of nursing home beds. Just 10 investment funds in Ireland control 30% of our nursing home beds. This didn't happen by accident. This isn't something that unfortunately happened, that Micheál Martin and so on is very sad about. It was deliberate government policy. As with private hospitals, the state provided private nursing homes with massive tax relief on capital expenditure, then guaranteed them income stream through Mary Harney's so-called Fair Deal scheme. Income for private nursing homes through Fair Deal has ballooned. Total funding is now over €1.2 billion a year. 80% of that is going to private nursing homes. The fees are incredible. At the residence Portlaoise, they're upwards of €1,200 a week. But not satisfied with that, the abusive, money-grabbing multinational Emis, which runs the residence, has also been ripping off elderly people and their families by illegally charging extra for essentials like medication, dressings and pressure-relieving mattresses to prevent bed sores. Incontinence wear costs up to €90 extra a month. A hip protector, €60 a month. If residents go to hospital, they have to pay for their own transport plus a staff charge of up to €45 an hour. How much of that do the carers see? Maybe a third, maybe a half, the rest going to the largest nursing home provider in the state. Families are charged €15 a week if they want to rent a sensor that alerts them if a patient falls out of a bed or a chair. Given the gross understaffing at residents, it looks like they would need it. Incredibly, there is no legal minimum staff to resident ratios for nursing homes. Presumably, the private providers lobby to keep it that way because wages are their main cost. That's why nursing home carers are among the lowest paid and most overworked group of workers in the country. That's how much this government and Fianna Fáil and Fine Gael value older people. The stock response is to say that better regulation is needed. Yes, absolutely. For years, care champions and others have been screaming about this, have been pushing for safeguarding legislation. This scandal should force the government to act. But ultimately, we're not just talking about a few bad apples. This neglect, this abuse is endemic in a system that is based on for-profit. We have to end the privatisation, bring it back into public ownership.